I'm Dr. Aihana Hashim. I'm a pediatric endocrinologist currently working at Sirima Bandaranaka Specialized Children's Hospital in Peradeniya. And today let's discuss about Ramadan and diabetes in children. So we know that in a couple of months the holy month of Ramadan is approaching, and we need to know what children with diabetes should do during the month of Ramadan. So in a normal person, when we fast, the insulin amount, so insulin is a hormone. We have been talking about diabetes the whole day today, and we know that when we eat something, there is a hormone called insulin which is produced in our body and which brings the sugar to the normal level. And when we don't eat any for a long period of time, our body automatically switches off the insulin in our body so that the sugar is maintained in a normal level. So when a person without diabetes fasts during the month of Ramadan or during any other day, the same process happens. So when they eat food at suhoor or at iftar, the insulin is produced in their body, and that will bring the sugar surge to a normal level. And during the period of fasting, the insulin production gradually drops and it stops so that the sugar is maintained in the body. So if you look at this graph, you will see in a normal person, throughout the 24-hour period, the sugar is more or less within the normal range. What happens in a person with diabetes? Unfortunately, in a person with diabetes, this normal process of insulin production and stopping of insulin production during prolonged fasting does not happen. So as a result of which, a child with diabetes can have sugar fluctuations when they fast. So during the period of fasting, their sugars may drop. As you can see in this graph, just before iftar, the sugars may become very low and you can develop hyperglycemia. And again, when they eat for iftar, at iftar, or when they eat at suhoor, there is a sugar surge, and then the sugar can shoot up, as you can see in this graph, where the sugar is seen to spike just after iftar. And if you continuously keep eating between iftar and suhoor, the sugar will remain high, which is not ideal. So let's discuss what are the risks of fasting. We are all eager to fast, and we know that during the month of Ramadan, when we fast, we are promised many rewards. So young children are eager to fast. Islam has not given any compulsions, and young children and people who are not well, pregnant mothers are exempted from fasting. But nevertheless, young adolescents and young children would love to fast in order to benefit from these rewards. So before we advise a child to fast, we need to see what are the risks of fasting. So why are we worried whether this child can fast or not? So one of the risks is the child can develop hyperglycemia. So they can develop low blood sugar. So in a normal child, because the insulin production will stop, they will not develop hyperglycemia. But in a child with diabetes, especially those on insulin, can develop hyperglycemia when they fast. Similarly, you can get hyperglycemia. So if your insulin dose is not enough, or you have eaten too much at iftar, for example, your sugar can shoot up. So that is also a risk of fasting. And the other risk is that if you do not take insulin while you are fasting, you can develop acidosis and develop this complication called diabetic ketoacidosis, where you develop large amounts of acid in the body, and this can be a very adverse complication. During fasting, we also do not take water or any drinks during the period of fasting. So they are also at risk of developing dehydration. So before the month of Ramadan, we need to find out which child can fast, and we need to have some pre-education counseling and educate the parents what needs to be done, what needs not to be done before we ask the child, allow the child to fast. So we need to tell the parent whether this child is at higher risk of developing these complications such as hyperglycemia. When you're fasting, we must tell them, okay, when they fast, what are the situations when you must break your fast before the iftar, before sunset. So there are certain conditions, certain instances, even if the child is fasting, they need to break their fast. Then the other thing is, when fasting, you need to check your sugars more frequently. You need to know when the child is developing hyperglycemia. So in a routine day, if you were to check 2 to 3 times a day, during fasting you might need to check 4 to 5 times a day to make sure that the child is having normal sugars. And then we need to educate the parents about what fluids, how to change, what diet they should take, and we need also to make some adjustments to the insulin if the child is fasting. So can your child fast safely? So before the child is planned to fast during the month of Ramadan, we need to make sure, is this child safe enough to fast? So there is a risk category, a high risk, moderate risk and low risk. So a high risk child is, for example, a child who has very poor blood sugar control before the fast. For example, if the HbA1c is very high, more than 10%, it is advisable that that child does not fast, or at least try to bring their sugars to a normal level before the month of Ramadan. Similarly, if the child has a child who is prone to recurrent hyperglycemia, so in the recent past the child is always getting hyperglycemia, such a child also should avoid fasting till we sort out that issue. And some children, especially older children and those who have had diabetes for a long period of time, say more than 10-15 years of diabetes, may not know when they develop hyperglycemia. That is called hyperglycemic unawareness. So in that case also, it is better for those individuals not to fast. Similarly, so a child who has had a good control, who is aware of developing hyperglycemia, who can tell the symptoms of hyperglycemia, who is willing to check regular blood sugars, that child we can advise to fast during the month of Ramadan. And what should you eat during the month of Ramadan? So it is important that to adhere to a healthy diet even during the month of Ramadan. I know in our community, depending on the social, the social background, we tend to eat a lot of unhealthy things, especially iftar. Our iftar meal is full of faluda and short eats and patties, which is not advisable. So if you want your child to have a good glycemic, good sugar control while fasting during the month of Ramadan, we must ensure the child also has healthy meal. So basically they can have a balanced diet for suhoor, which is the morning meal, and they should also have a balanced meal for iftar, and then in between the two periods they can have a maximum of 1 or 2 snacks, which is about 1 portion. So basically, if your child has been taking 3 to 5 portions for breakfast, lunch and dinner, they should try to stick to that 3 to 5 portions at suhoor and 3 to 5 portions at iftar, and maybe a 1 portion snack in between. And what is a balanced diet? So they should, as we have advised in the clinics before to the children about carb counting, so we must tell them to have complex carbohydrates, that is if it's a rice based meal, or if it is bread with wholemeal bread, or if it's rice with lot of vegetables. And it's advisable not to have sugary drinks, avoid desserts, avoid having a lot of sweet food items, especially after iftar, and to avoid having these patties and short eats, which are completely unhealthy during the month of Ramadan. So I will show you a slide which shows what a healthy plate should be, and this plate describes that if you were to eat rice, it should be about 1 to 1.5 cups of rice with lots of vegetables and a normal portion of protein. You can have 1 to 2 dates and maybe a slice of watermelon with a glass of milk. So this is how your Ramadan plate should be, where you are still sticking to a healthy diet even during the month of Ramadan. So when there are some instances the child has to break his or her fast before iftar in certain instances, and one of it is if the blood sugar is less than 70 milligrams per deciliter, the child has to break fast, because the child will it is not good to have hyperglycemia and continue the fast. Similarly, if child develops symptoms of hyperglycemia such as sweating, palpitations, hunger, and if they develop headache, confusion, you must make sure the child breaks the fast and you administer glucose and the child has a snack after that. Similarly, if the child develops symptoms of hyperglycemia such as increased thirst, polyuria, and abdominal pain, nausea, vomiting, in such instances also the child should break the fast. And while if you check your blood sugar, so if the blood sugar is less than 70, the child must break the fast. If the blood sugar is more than 300, again the child should break the fast, have a snack, and you need to continue to administer insulin. So how frequently should you check the blood sugar? You must check the blood sugar at least 4 to 5 times during the fast to make sure the child does not develop low blood sugars or very high blood sugars. So you need to check the blood sugar just before the child has iftar, the suhoor that is the morning meal. Then the child should have a blood sugar ideally a couple of hours in the morning. Then mid-noon at about 12:01, that is their lunch. On a normal day they would have had lunch at that time, so you need to make sure the child has a blood sugar check at about 12:01, and then again one in the evening if possible, but at least one before iftar, to make sure the child has not developed any hypoglycemia before the child breaks fast at sunset. And then again ideally a couple of hours after iftar, the child should have a blood sugar check to make sure that there is no high blood sugars just after iftar. How do you adjust the insulin dose during the Ramadan? So the morning, if the child is on a fixed dosed insulin, that is they receive fixed doses of insulin in the morning with breakfast and in the night before dinner, the morning dose of insulin should be administered with suhoor. So in the morning, when you get up at 4 o'clock in the morning, you should have the insulin, and half an hour later the child should take the suhoor. And then again if the child's night dose of insulin, which you would normally give with dinner, that should be given at iftar, and half an hour later with the calling of the azan for the evening prayers, they can have the iftar. So they should have the insulin. You should make sure that the insulin is given at least half an hour before they have their meal at these 2 times. If the child was also on a lunch insulin, that lunch insulin dose can be omitted. So when you check the blood sugar, if for example during the daytime, if the blood sugar dropped to 90 or below, the next day what you should do is you should reduce the morning dose by at least 20%. So say the child was on 20 units of pre-mixed insulin in the morning, the next day if the child developed a sugar of less than 90, that day he fasted, so the next day you must give 16 units of insulin in the morning. And if the sugars are more than 250, that means the next day you should give more insulin. So if you gave 20, the next day you must give 22. So that is why you need to check the insulin dose. Similarly, if the morning insulins are low or high, you should appropriately reduce the evening insulin amount that you're giving. If the child is on a basal bolus insulin, where you're giving a long-acting insulin like Lantus or Glargine at night, you should reduce that by 10 to 15%. So for example, if the child is taking 20 units of Glargine at night, you should reduce it to 18 units, and then depending on the blood sugar, if the blood sugar is between 90 and 150, you continue with the same doses. But if the child develops sugars less than 90, you should reduce the dose by 20%. If the child's sugars are more than 250, you should increase the insulin by 20%. And what do you do? So some children with type 2 diabetes may also be taking oral hypoglycemics like metformin, norgliclazide in addition to insulin. These children, if you are taking metformin for example once a day, you can take it in the evening with your iftar. If you are taking twice a day, you can take it in the morning with your suhoor and one in the evening at iftar. If you are taking thrice a day, the lunch dose you can combine it with iftar. Similarly, gliclazide, if you are taking gliclazide once a day, you take it at iftar. If you take it twice a day, you take it one in the suhoor and one in the iftar. If the child develops hyperglycemia, that is a blood sugar of less than 70, or if the blood sugars are marginal like less than 90, you can reduce your or stop your morning dose of gliclazide. So very briefly I will tell you about what are the complications of diabetes. Why are we all talking about having a good glycemic control? You do not feel symptoms sometimes when you have sugars of 300, 400, you feel fine. But what is the long-term problem of having uncontrolled blood sugars? So it can affect your eyes. You can have what is called retinopathy, and that can lead to blindness. It can affect your heart, and you can have strokes, you can have heart attacks with time to come. Then you can have nerve damage. You won't feel pain. You won't feel when there is a wound. So you can get foot ulcers. You can develop wounds very quickly, which can result in your foot needing amputation. Then it can affect your kidneys and cause renal failure. So I hope I have given you some understanding about what needs to be done during fasting and diabetes. So my key messages would be: 1. Yes, your child can fast. But 2. You need to make sure that you check your blood sugars regularly. You need to make sure the child has a healthy diet. You need to make sure from the time the child breaks fast from iftar to following day suhoor, the child has adequate water. So they should not take sugary drinks, but they should take a lot of water. Then you might make sure if the child is on insulin, you must not stop the insulin. If the child is fasting, you need to give the insulin, but the insulin doses can be reduced if the child is developing low blood sugars. On the other hand, if you find that your child develops high blood sugars while fasting, then you need to actually increase the insulin dose. So never ever stop the insulin thinking that the child is going to fast. So these are my key messages for the child who wants to fast. They can fast, but you need to know that you need to make sure that the child checks the blood sugars regularly. And if you need to clarify further or what to do, you can approach the diabetes clinics which are being run at Lady Ridgeway Hospital, at Karapitiya Teaching Hospital, and at the Sirima Bandaranayake Hospital to find out more details and to get more information on how to manage your child with diabetes during fasting.